parents responded by looking at that blue line, which is the 2018 number, and that was to the same question. Now, planting that seed of knowledge on the dangers of alcohol use and expectations are super important, but equally as important is continuing a consistent conversation with your teen and keeping those topics varied when discussing substance use and consequences. But here's some good news. Parents share similar beliefs when it comes to their views on how wrong or very wrong it is for their teen to drink alcohol, whether it be for a certain non-religious occasion, to provide alcohol to others' teens, or for another adult to provide alcohol to your teen. The consensus is it is not okay. A stance that did not change from 2018 to 2020. So same question in 2018, you see those numbers there on the side. So remain clear and consistent with your messaging when talking about alcohol use with your teen and continue to set those clear boundaries. Now, unfortunately, those shared views spill into how teen alcohol use is seen by Stevenson High School parents as grade levels increase. When asked, how wrong do you think it is for students to drink alcohol at the following grade levels, we see a huge drop from freshman to senior year, meaning parents are reporting they think it's less wrong for upperclassmen to drink alcohol. A similar trend we see in 2018 in the blue. Now, it's important we all acknowledge that not only is consuming alcohol before age 21 illegal, it's also but also until about the age of 25, our brains are still developing. And to finish this portion on a positive note, when parents were asked to indicate what percentage of students they believed used alcohol in the past 30 days, the highest reported percentage was 21 to 30% of students. Well, out of the over 3,000 Stevenson High School students who responded to a similar question this year, over 80% of them said on 0 occasions in the last month had they consumed beer, wine, or hard liquor. So it's easy to overestimate those numbers, but your continued efforts do matter and y'all are doing a great job. So I'll hand this over to my colleague, Mia.
Okay, good morning, everyone. So now we're going to switch substances and we're going to talk a little bit more about prescription and illegal drugs. And just for a reference, when we say prescription drugs, we are referring to stimulants, anti-anxiety medication, as well as pain medication. And as far as illegal drugs, we are including heroin, cocaine, ecstasy, and crystal meth. So when it comes to perceived use, most parents believe that less than 10% of students are using prescription and illegal drugs. When asked what percentage of Stevenson High School students do you think use prescription and illegal drugs in the past 30 days? About 40% of them actually said that they believe less than 10% were using prescription drugs that weren't prescribed to them. And about 48% of parents believe that less than 10% were using illegal drugs. Now, that was the majority, and it's also worth noting that only 28% of parents believe that between 11 and 20% of students were using prescription drugs that weren't prescribed to them, and 27% of parents believe that 11 to 20% of students were using illegal drugs. And only 15% of parents believe that more than 30% of students were using either prescription or illegal drugs. Can you go to the next slide, Lauren? So when it comes to the actual usage rates for prescription and illegal drugs, only less than 2% of Stevenson High School students actually reported using prescription drugs. And furthermore, only 99% of students said that they never use prescription stimulant drugs or illegal drugs, which is really great news because that means the majority of students aren't using. And now, while the majority of Stevenson students are not using stimulants, I would like to take a moment to briefly look at the research behind why students use stimulant drugs to begin with. In a recent study, it was found that students' motivations for non-prescription stimulus use were the belief that drugs would enhance their concentration, help with studying, and provide an increase in alertness. So there's that consistency in that students were reporting academic motives for using non-prescription stimulant drugs. 13% of people who engage in non-prescription stimulants used at the age of 19 became stimulant dependent. And research shows that students who believe that there are academic benefits to using non-prescription stimulants and have frequent patterns of drinking and marijuana use are more likely to engage in non-prescription stimulant use. So while our students aren't using stimulants at this age right now, it may be important to monitor, especially if, alcohol and marijuana use is a problem. And that's all we have for prescription and stimulant use.
All right, so, and hopefully everyone can hear me. I have a very loud AC unit, so yay for that. But now we're going to transition over to marijuana. And if I have any hiccups, I do apologize. My staff who are currently in a training were originally going to present this, but hopefully I will do so with as much grace and preparation as they did. Now, with marijuana, in the survey, it does use the term marijuana. We know that the actual name of the plant is cannabis, but we wanted to be consistent with the survey's language. And if you could go to the next slide, thank you. So here we have a little graph just explaining or illustrating the perceived usage rate. So what percentage of Stevenson students does the parent who responded to the survey think used marijuana within the past 30 days? And as you can see, it does have a bit of a varied response to it. We see that most people are gauging towards, not that many students have used in the past 30 days, but we do see that there are some parents who are saying, oh, there are half of all the students who have used marijuana in the past 30 days. So whenever we talk about perception, as you've seen throughout the presentation, if you could go to the next slide, please. We also need to compare it to the actual use rate. So 93% of Stevenson students reported that they haven't used marijuana in the past 30 days. And then in addition to that, 87% of students said that they never used marijuana. And so this is great news, right? It's a fabulous validation that the prevention efforts are working. However, our work is not necessarily done just yet. Now, this surveyed population who thinks it's very wrong for students to smoke marijuana tends to decrease as the students age up. And especially after legalization of marijuana, we have seen, well, if there's more of a prevalent use, whether it is legal or not, there is a decreased perception of risk. And so if students and parents are seeing that other people are using marijuana, they don't really think it's that big of a concern. And if you could go to the next slide, please. Thank you. And we see that this trend continues into 2020. So that last slide being 2018 and this one being from this year. This trend is pretty much continuing. It's about the same, right? And yes, there are most people who are saying it is still very wrong. There is some degree of wrongness attached to marijuana use. The impacts of legalization can be seen not just in the student perception, but also the adults. All right, so here we have a brief parent profile about marijuana. What do parents think in regards to marijuana? And when they were asked, how wrong do you think it is for teens to witness an adult using marijuana, 27% of them believe that it's wrong for them to see that. And then 56% of them believe it is very wrong to see that happening. And like I said, due to legalization, there's more witnessing of use out in the community. And whether they actually look like they're an adult or they could just be passing for a 21-year-old or older, that higher prevalence still lowers perception of harm, which then leads to an increase in use. So while these people who are using may not necessarily be saying, oh yes, youth should definitely use marijuana, that implication of it not being as big of a problem is still present. And here we're just comparing those numbers in a more succinct manner so that you guys can see very comparatively right beside each other how different it looks. So in 2018, the wrongness, just wrong, not very wrong, but wrong was at 22%, and now it has increased to 27. But at the same time, very wrong has come down, a bit substantially. And like we mentioned earlier, this is not a statistical data analysis. We're not doing t-tests or anything like that. But when it comes to the number of participants who said it was very wrong, that has decreased over the years, or over the past couple of years. And so now we're going to go into perception of harm. So how much do you think a teen would risk harming themselves, whether it's physically or another way, if they smoke marijuana? And it might be a little small. I'm not sure if you can see it, but there at the bottom, it just delineates between, if they smoked marijuana once or twice a week in 2018 versus 2020, or if they smoked marijuana almost every day between the 2 years. And they're about the same. I can't remember the N sizes for both surveys, but we see that the rates are comparatively similar. Next slide, please. Thank you. And so when we're looking a bit more about what parents are thinking in regards to marijuana, we see that 86% of them have spoken with their teen in the past year about their expectations, their rules for marijuana use. In 2018, it was 85%, so there is a little bit of a bump. And then 91% of the parents who responded said that they spoke with their teen about driving or being in the car with someone who was under the influence of marijuana or other drugs. And this is a 3% increase from the 88% back in 2018. And so really the encouraging part here is, if you are having those conversations, great. Keep continuing to have them and have them more often. It's not just let's talk about it once and then you'll just remember it forever. We know that we need to have multiple conversations before information starts to stick. And then when it comes to perception of risk and accessibility of marijuana, or there's a perception of risk and then the accessibility of medical marijuana being unavailable. Teens can't just walk into a dispensary, but this ability to still have marijuana in the community still does affect perception of risk, whether it's medical or recreational. Next slide, please. Thank you. So here we see that out of at least for about 300 parents, most of them have said we would support drug testing students involved in co-curricular activities as a deterrent for use. And in the survey, it doesn't necessarily specify a specific drug that they are more fervent about getting tested, and it doesn't specify what kind of curricular activity. It could be a club, it could be a sport. It was all conflated in the survey. But we see here that in 2020, 87% said yes, and then the last survey before that, 86% said no. So about the same, we're seeing a bit of an increase in terms of those who would want to test their students. And with this, Stevenson parents, they have the right ideas, right? Like Stand Strong is here, of course, to provide additional guidance. And so when these parents are asked, and the majority of them said yes, it's important to keep in mind that testing for an often accessible substance like marijuana would require looking into different testing methods. So, taking into account your student's weight, age, sex, and the amount of alcohol that is consumed. These confounding factors could invalidate results. So if you have any particular concerns, it's important to point to professionals who might know more about specific drug testing, whether they're in law enforcement or it's a healthcare provider like a pediatrician. All right, so what do parents perceive about other parents? Now, 95% of parents think it is wrong or very wrong for their children to be given alcohol, which, is great. And Oh, did I hop ahead of myself? Let me backtrack just a little bit. Now, when first asked to what extent do other parents share their values and their expectations about underage substance use, you know, 2% said they don't think it's shared at all. 20%, about a fifth of them said, it's slightly shared. And then the rest think that there's either a moderate extent. We see that 58% of them agree with that. And then 19% said it is greatly shared, that this is a good validation for them to know that they are not alone. So most parents believe that other parents are still sharing their values. It's more than just the majority. And we know that from our data, however, that almost every parent shares a similar view on drugs and alcohol with the next parent. Just underage substance use not being something they want to promote. And so it's important to encourage the parents that they aren't alone. As I was saying earlier, they have support, and Stand Strong, of course, is here to help. And parents tend to underestimate the amount of other parents whose values do align with their own. And so really encouraging them to understand that this is a part of their community is still very important. And it's also very similar, if you're familiar with the social norms marketing used in schools, it could be useful to use a similar tactic, a similar approach, and just correcting the norms to shift more towards reality as opposed to any kind of just based on perception assumption. All right, and so some final thoughts. It's important to think about what messages a parent is sending to a child. They need to reinforce that, less or fewer students are using more so than they think. The perceived use is typically higher than the actual rate of a substance being consumed. And it's important because of social norms, where we have student data from Stevens's version of the IYS, where they have the actual rates. And so there is a chance or an opportunity to disseminate that information and correct any kind of overinflated misperceptions. With the second point, it's especially important around high use times to monitor and guard whatever is in your house, whether you have an alcohol cabinet, whether you have prescriptions or your student has prescriptions, or if there's any marijuana in the house. High use times are historically homecoming, finals, breaks, prom, any kind of opportunity where the student is not spending most of their time in the high school, where they're not surrounded with, additional supports to monitor them and keep them safe. And 53% of parents in the survey, they did say it would be easier for their students to access alcohol, especially around these high use times. There's a lot going on. So it's important to make sure that this monitoring is happening throughout the year, but especially being increased and more intentional during those high use occasions. On this third point, it's particularly important to have regular conversations rather than just lengthy ones that are few. The car is a really good opportunity to send a clear no use message and share your expectations. You're both in the car, no one's talking to another person, and it's kind of a nice captive audience sort of setting. And it's a bit less stressful. It's not as formal as you would think that shows typically see, where you're just sitting down, you're facing each other, you have a written out agenda. It doesn't always have to be so formal. And then with these next couple of points, with 4 and 5, alcohol and marijuana is illegal. It's just as illegal as it is for a freshman, a junior, a sophomore, anyone who is, 21 years old and 364 days, right? So it's important to be consistent, not just with anyone you're co-parenting with, but with any other messages that law enforcement may be giving. And so you want to be mindful of what is legal, what is permissible, and also at what point could your youth even handle having a substance. Depending on the study you look at, the brain stops developing anywhere from between 24 years old and 30 years old. So even if they're 23 and it is legal for them to use a substance, it's important to talk with them about, is this something that physically you would be able to handle any kind of negative repercussions. And then finally, just to emphasize, parents believe, what you do. Parents believe what other people are doing. It's a shared value. So really encourage parents, as well as yourselves, you're not alone. It's very common to think that you are, but most people think it is wrong for parents or for teenagers to use substances. So don't be afraid to talk to other parents about this. make sure you have those conversations with your child's parents and that everyone is on the same team, because this kind of topic can be overwhelming. And when you find out you're not the only one, there's an entire coalition or community behind you, it seems a little less daunting. And that is the presentation. So if there are any questions, the team is more than happy to take some. Marty, it looks like you have one. Oh, you're muted.
All right, so we've,
Okay, so I'm back.
there you go, Marty.
Okay, thank you. Here's my question. Well, my first question. What month was this study done?
It was before COVID. I think it was
It's January. Yes,
Yeah.
January of
Okay.
this year.
Okay, so my question then, what effect do you think COVID has had, knowing that the students basically are in the home with their parents, not with peers of their own from school? What do you think the effect is going to be now with depression and the possibility of other things involved? How is that going to affect the study?
That's a really great question that almost everyone in prevention is trying to figure out. We know that every kind of rate, substance use, domestic violence, mental health, adverse conditions, they are all, we're seeing that there's a really big spike in all of them since the shelter in place happened. However, there is no data collected by Stand Strong on that. So it'd be really interesting to see if there's any opportunity to gather COVID related data and kind of compare that with any existing efforts, just to see, well, we know in 2020 before COVID, this is what substance use in the past 30 days looked like. It's easy to, well, I'll backtrack a little bit. There was a counselor that we talked to during a Link Together meeting, and what she anecdotally did report was that they are not seeing a lot of new users. There's not many outputs or outlets for them to get substance use, but they're seeing a very large increase in the frequency of users who are already using by COVID. So if they were smoking every day, they're smoking several times a day now. So that's one aspect in which it could change. But like I said, there's a whole lot of information that just hasn't been collected yet.
Here's my concern. Someone who was a judge at the Illinois State Science Projects. Anyway, what I'm trying to say is that the scientific method has to take an effect on what you're doing, because otherwise the end results have very little meaning unless you take everything into consideration. And I'm real concerned about if you use the study the way it is right now, without taking into consideration all of what's going on. I just don't know where this study stands.
And I think that there are some parts of the data that can still be applicable. You know, there's always transferable value to some degree. So like we've seen mental health or emotionally speaking, a lot of parents, even though they're at home, maybe they're at home with each other more, they might even more so feel alone. They don't see other parents when they drop off their kids at school. They don't see other parents at work, but the values, that shared value of not wanting your child to be anything besides safe and healthy still exists. So in that kind of way, that message can still be put out. In terms of actual data use, obviously we don't have that, but you know, the more shared ideals are probably still very valid.
Thank you.
Other questions about the presentation?
Chief, I was interested in hearing maybe from our participants if there are other strategies that are used to help keep their young person safe, just as a way of sharing with each other how we protect our kids.
Sure. Would anyone like to comment on the general strategies of what we've discussed and what was reviewed in this presentation about? don't see anyone reaching for the mute button or waving. I don't have a hand up. I will comment that I always find it interesting, this long, and perhaps for people that maybe this is one of their first presentations, but I've long found it interesting and a consistent theme, and perhaps the presenters could speak to this a little with a little more polished. My observation has been there is always this trend where teens, when asked these questions, have this impression that substance use is much greater than it really is. It seems like every time we see this data, the real use of substance or acknowledgement of substance use, whether in the last 30 days or ever, is always trending much less than that same population when asked, what are other people doing? Their impression is always everyone's doing it, or a much greater, and that trend seems to continue. And I'm just wondering if the evaluators, have anything else to say about that. I always find it interesting.
Yeah, what you talk about, Chief, is really, we see it in every community that we work with, every community, every school. There is an overperception by students and adults, be it staff, be it parents. And what contributes to that is the fact that we as human beings, we tend to only notice that which is not kind of the norm, if you will. What are the majority of people doing? We don't notice the fact that 80% of our kids are just going through life, going to school, doing what they need to do, attending their sports, watching a movie on Friday night with their parents, not going to a party, hanging out at home. I have an example of my son. When he was younger, we were driving down the road and he said to me, "Mom, how come so many people smoke cigarettes?" And I said, "Well, that's a really interesting question. Why do you think that?" And he's like, "Well, everybody we drive by," yes, I must have been speeding, "everybody we drove by had a cigarette." And I'm like, "Really? Is that true? Let's count." And so when we actually started to count the number of people in the cars who were smoking cigarettes, it was far less than those that were actually smoking. And it lended me an opportunity to speak to my son about why we often think that more people are doing things that, cheating on taxes, smoking cigarettes, using substances, the list can go on. Because we only hear about, or we only see those who are doing what is, I hate to use the word abnormal, but we don't notice the majority who are really just acting like us and living life.
Thanks, Margaret. Nope, I always find it interesting.